everybody, it's Kiva Price Pilates back again, and today's article review video asks the question, can Pilates-based exercises give nurses a helping hand? Here is the title and where you can find the article. This study investigates the effectiveness of 6 months of Pilates-based exercises for 219 female healthcare workers. They were 30 to 55 years old, had 4.7 out of 10 subacute low back pain, and performed Pilates exercises 2 times a week for 24 weeks. Nurses have physically demanding work duties like lifting patients, standing for long periods, and working in a forward bend position, all of which are biomechanical risk factors for chronic low back pain. This study looks at pain intensity, pain interfering with work, lumbar movement control impairments, fitness components, and work-related factors between the exercise or Pilates group and non-exercise group. This was done after the intervention, the exercises, and at a 12-month follow-up. The purpose of the 6-month program was to decrease movement control issues due to pain and increase muscular strength and endurance needed in heavy nursing tasks. At 2 months, they learned to correct performance technique, control neutral spine during low load exercises, and combine breathing with exercises. In the next stage, they increased their demands for balance, coordination, muscular strength, and endurance. Training principles in this study included increased spinal stability using low-load exercises like these, for example, but also to promote a high level of muscular activity, increase muscle strength and endurance, improve balance and posture control, combine breathing with exercise, increase strength of legs for squatting movement, achieve normal range of motion of the spine, especially in the thoracic spine, and hip and ankle joint. Key principles of Pilates, as shown here, were followed in this study with the emphasis on internal feedback of the posture of the spine in each exercise to separate the movement of the lumbar spine from the movement of the hip joints and thoracic or mid-back spine. Imagine if Nurse Betty wants to help patient Smith get out of bed without low back pain. Learning how to keep her low back stable while the hip and the thoracic spine are still moving can be the difference between Nurse Betty having a good or bad back day. The result: the nurse's inability to effectively and efficiently move their spine, aka motor control impairment, decreased. Yay! They can move their spine better. But wait, there's more. Improved control of lumbar movements did not correlate to a decrease in pain. Bummeroonie! My hypothesis is due to the way motor control impairments were measured. As you can see here, the motor control impairments were measured by this forward bend posture, by posterior pelvic tilt, and also by knee flexion. In nursing duties, these movements are not very prevalent. Just because they ace these tests, the nurses in this study ace these tests, does not mean they won't have pain with typical nursing duty. On a brighter note, the exercise group showed decreased difficulties at work, which correlated to a decrease in pain intensity. The exercise group also reported being less tired and had better recovery from work. They apparently didn't have to rush home and drink a glass of wine and binge watch Netflix all night. In the exercise group, overall pain decreased and pain interfering with work decreased. An added bonus was that the abdominal strength was improved. Abdominal strength was the only fitness component which showed improvement. They measured improvements using these field tests, like modified push-ups, one-leg squats, and modified sit-ups. Exercise has many benefits. Exercise activates these endogenous pain inhibitory mechanisms, which lead to a reduction in sensitivity to noxious stimuli. Okay, i.e., exercise gives you a natural high, making you less sensitive to people, I mean things that make you say, ouch! Placing an emphasis on how you move is an effective training technique to transfer beneficial movement control patterns to work activities in any career. Being focused on how well you do your exercises carries over to how well you move when you work. So, looks do matter after all. So, what exactly caused the nurse's relief of pain? Well, it's hard to tell. It could have been the exercise itself, or them learning to control their movements of the spine better. Also, could just be muscle strengthening, or their focus on breathing with the movement, or a combination of everything. So, in conclusion, this 6-month Pilates type exercise program was effective for healthcare workers with subacute low back pain and reducing pain and limitations in moving the spine, decreasing pain with interfering with work, improved abdominal strength, and improved ability of the nurses to perform work duties were also improved. I'm sure this could be effective for employees of other types of heavy work as well. Maybe a program like this could be implemented as part of an employee's injury prevention program. That's an idea. And then Pilates can be a worker's best friend. More article reviews, subscribe to my YouTube channel, or follow me on Instagram at Kiva Price Pilates. See you next time.